Is PRP treatment good for genetic hair fall? I'm 21 years old, and I have had genetic hair fall since the last 3 years. To do a hair transplant, I have to wait 4 more years. Will PRP control my hair from thinning, or will it just energize tiny hairs that are left on my scalp? Should I go ahead with PRP?
Thank you for your question. You're 21 years old and you state that you've been having hair loss for the past 3 years, and you've submitted 2 photos that clearly demonstrates the extent of your hair loss. And you're asking about PRP to help manage your hair loss in light of the advice you were given to wait about 4 years before undergoing a hair transplant. So I think that the overall question is about what you can do before doing a hair transplant. Well, I can certainly share with you my approach to helping patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. In fact, I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed which evolved out of hair transplant to non-surgically treat hair loss in men and women with genetic pattern loss using PRP and extracellular matrix, which I'll describe in more detail later. So to begin with, it's clear that you have a very aggressive pattern and a young onset. And so in our practice, and we treat patients all over the world for hair loss using this treatment called hair regeneration, and I'll explain to you a little bit about it in the context of what PRP does. Now, PRP, platelet-rich plasma, just to review, is a concentration of the wound healing and growth factors needed when you have an injury, and when concentrated can be applied for a variety of indications. In our practice, we use it for acne scars, for wrinkles, for under-eye dark circles, to help with incisions and wound healing. And in respect to hair loss, it has been many times proven that PRP can stimulate growth in hair loss. And the dermatology literature is recognizing the benefits, and a lot of ideas are being generated about the mechanisms, which are clearly much more complex. But the basic idea is that PRP can help people with hair loss. The challenge is how sustainable is the treatment of PRP, and will it really last as long as is potential? And this is where our treatment, which we developed starting about 7 years ago, called hair regeneration, evolved out of our use of PRP with the material called extracellular matrix or acellular matrix. This is a wound healing technology which leverages your body's own adult stem cell activity for tissue repair. So, for example, if there's a muscle injury, it helps muscle regrow, and as opposed to scar tissue. Now, this is fascinating, and we were doing this initially. We were doing this to help hair grafts heal better during hair transplants. It's well known that not every hair graft that is transplanted makes it, and results can vary. So we want to improve the outcomes of the hair transplants with acellular matrix. We also want to improve the wound healing of the donor area incisions. Well, a side effect resulted, which was that thinning hairs appear to get thicker. From that point forward, I made a decision to pursue the possibility of leveraging this method to help people with thinning hair. It became clear to me that majority of people who seek hair transplant are not bald people. They're people who have thinning hair, and they're losing hair, and they're trying to keep up with the loss. Well, if we can thicken existing thinning hair, well, we can actually move the clock back and actually improve the overall volume. And over several years, it's been clearly demonstrated with our method that we can actually not only get the coverage of a hair transplant, but in many cases we can exceed the coverage of 2 hair transplants. Which is a bold statement to make, but it is true. Now, that being said, in the context of your situation, we've established with hair regeneration treatment that people of all ages, with our protocols, we're able to get about 5 years at least of stability and improvement. Basically, we're able to reactivate hair that's not growing, stimulate the growth of thinning hair into thicker hair, induce the shedding of thinning hair and replace that with thicker hair. And very importantly, we're actually able to stop the progression. However, I have looked at people from different lenses, and when I think of a variable that currently is being challenged because of concerns about the drug finasteride, I'm looking at patients in a way that, as it relates to possibly relative DHT sensitivity. So when I see a young person losing hair very aggressively, it is possible that your hair is very DHT sensitive. DHT stands for dihydrotestosterone. Testosterone is converted into dihydrotestosterone, DHT, by an enzyme called 5-alpha reductase. Now what happens is hair follicles that are susceptible to DHT will actually miniaturize. So you have to ask the question, why is it when you're in your 20s you're losing hair while 80% of your contemporaries are not? And one possible variable in that explanation is relative DHT sensitivity. So in my practice, I do counsel patients to consider taking finasteride as a way to diminish the DHT dose on their hair. So that's something that PRP cannot affect is DHT levels. Now that being said, there is an opportunity with a treatment like what we have called hair regeneration to do something that a DHT blocker does not do, and that is to stimulate hair growth. What I believe is occurring with hair regeneration is we're effectively prolonging the growth cycles. In some ways, we refer to it as like extending the warranty on the hair. Now, there's a challenge, of course, when people have aggressive hair loss like you do. And there are going to be people that don't necessarily respond. But I think that in your position, it's probably in your best interest to do everything you can to slow down your progression as well as to stimulate growth to get maximal coverage. Unfortunately, even though you are 4 years away from a hair transplant in this situation, a hair transplant isn't the perfect solution because the rate of hair loss in your situation is likely to rapidly exceed the rate in which replacement can provide reasonable coverage based on what the degree of loss that you've experienced in the past 3 years, and you're only 21 years old. So it's important that you understand the limits of the surgical option, as well as try to learn more about how to maximize the longevity of your hair and maximize your coverage. Hair loss is unfortunately much more complex, and we have a limited number of tools. Hair regeneration has essentially become a new category that allows our patients who come to us, again, from all over the world, improve the longevity of their hair growth cycles and maximize the coverage, and for many patients actually defer having a transplant. So learn more about these options, and I think that the earlier you seek attention, the sooner, the better it is for you based on this rapid progression. So I hope that was helpful. I wish you the best of luck, and thank you for your question.